Hello again. And today we are going to talk about diabetes and fasting. Often I get asked by my patients, Doctor, can I fast? And we know from recent studies that intermittent fasting is actually quite good for health, not just for diabetic patients, but for normal, healthy individuals as well. So, how does that fit for diabetic patients? And why do we need to be careful and talk about fasting in diabetes? Can they actually fast? What are the risks and who can fast, who can't? Lots of questions. So let's have a discussion, and this is all you need to know if you are a diabetic and you want to fast. So first, let's look at the physiology. What happens inside your body when you're fasting? So take a normal person, for example, and suppose he's fasting for more than 8 hours. The energy sources are taken up from your stored glucose in your body. So the glycogen or the glucose store starts getting depleted. That's fine if you're a non-diabetic person. But just imagine for a diabetic individual, if especially he's on insulin or tablets which reduce his blood sugars, that's going to be a problem. Because as soon as those 8 hours are wearing off and the glycogen or the glucose stores are getting utilized, he's going to have the symptoms of hypoglycemia or low sugars. So we need to remember the physiology of fasting. So what kind of people in diabetes can actually fast? And for whom is it safe and not safe to fast? So this is actually quite individual and one size doesn't fit all. I mean, when a patient or a person comes to you and asks, can I fast? Then you have to take into account his age, his medical condition, his overall diabetic control over the past few months. So if the person is a child or extreme of age, like an elderly or frail person, I wouldn't recommend him fasting at all. If that person's medical condition overall is not great, for example, he has had heart attack or stroke, and or if he's got learning disabilities, it's not as advisable to fast. The other important point is if overall blood sugar control, which we assess by something called as HbA1c, which you may have heard anyway, that's your 3 months average blood sugar test, and that percentage, if it is less than 7 to 7.5, that tells me that overall diabetic control over the last 3 to 4 months is pretty good. So that again is a positive indication that the patient may be advisable or suitable to fast. Again, you have to take into account, has this person had any diabetes related complications and what are they? So basically, if somebody has got evidence of retinopathy, whereby high blood sugars affect his retina or vision, or he's got diabetic foot complications. So he's got ulcers or he had amputation in the past. It's not really advisable to fast. Or if somebody has had diabetic ketoacidosis, which is one of the emergencies, or hypoglycemia. So any extremes of blood sugars for which the patient keeps on getting admitted, either for high blood sugar or for low blood sugar. So fluctuations and unstable blood sugars is not a good idea to fast. So having said that, you discuss with your doctor, the doctor looks at your medication, looks at your history, and if it's a female patient, making sure that she's not pregnant or breastfeeding, the doctor gives you go ahead, green signal to fast. Make sure that you discuss the medications as well before that. So somebody on insulin, they may need regime change. So insulin may need to be changed in terms of type and the frequency because you're not going to have normal 3 meals per day. So it's very important that you tell your doctor what medications you're on. For example, something called as sulfonylurea, or we call it SUs, commonly known as gliclazide, glimepiride, or glibenclamide, they can cause hypoglycemia or low sugars. So it's quite important that your doctor knows about it and he can change your medications to something different, which may not give you the risk of hypo. and insulin. That regime may need to be changed. So medications are a very important part of your discussion with your doctor if you're planning to fast. So all this good, and your doctor says go ahead, green signal, and you start fasting. So what foods should you eat before the fast starts? So if you're planning 1 meal per day or 2 meals per day, make sure that your food has got something, some carbohydrates like starchy carbohydrate, which release the energy slowly. So something with low GI index, as you know, glycemic index. Such foods are multigrain bread or pita bread or even basmati rice. But make sure that you have it balanced with your lentils, your proteins, pulses, and your fruits and vegetables. So it has to be a balanced diet. Do not go into fatty, fried, deep fried foods, and do not go into fizzy drinks or sugary drinks. But make sure that you increase your water intake and maintain it throughout the 24 hours. Now, this advice may vary if the patient has got CKD or he's a dialysis patient. CKD is a chronic kidney disease. So if you've got kidney issues or dialysis problems, this advice may vary, and your doctor can suggest what exactly to eat and what exactly to drink and how much you're allowed. But this is general advice for anybody who wants to fast and is diabetic. So you've got everything, you start fasting. Just imagine that your sugars still go down below 70. What should you do? So if your sugars are below 70, that is hypoglycemia, you must treat it. So that may mean breaking your fast. If they go above 300, that may again mean that you need to call your doctor urgently for advice. And again, that may mean breaking your fast. So remember, health comes first. If you're safe and healthy, you can do more fasting in future. So these are the tips you need to remember. Make sure that you monitor your sugars regularly if you're on insulin throughout fasting. So checking your blood sugars doesn't mean breaking fast. Make sure you're healthy and enjoy your fasting. Thank you.